Welcome to the Unexpected Detour, where unexpected moments become meaningful conversations. I am Frances Hammond, and I'm grateful you're here with me today. Sometimes the things we dismiss too quickly may carry more value than we realize. Sometimes what appears ordinary can hold a deeper story. And sometimes conversations we least expect become the ones that teach us the most. Today we're talking about wisdom teeth. For many people, wisdom teeth are associated with pain, swelling, surgery, and recovery. But researchers have also explored whether these teeth may contain something useful and valuable. So let's talk about it. As always, this episode is for educational and reflective purposes only and is not medical advice. Please note that. Wisdom teeth are the third and final set of molars. They usually emerge during the late teen years or early 20s. Some people experience no problems at all. Their wisdom teeth grow in normally, fit within the mouth, and cause no disruption. Others, however, experience a very different journey. For many people, wisdom teeth may grow sideways, remain trapped beneath the gums, crowd neighboring teeth, or cause infection and pain. This is known as impaction, and it is one of the main reasons many dentists recommend removal. Because of these common issues, wisdom teeth have been viewed as something troublesome that simply needs to be taken out and forgotten. For years, that was the entire conversation. But today, another layer has been added. Are you ready for this? You're going to be surprised, or you might already know. But this was something I discovered while having a conversation with a breast cancer sister, and she told me this. So I'm going to tell you. Inside each tooth is a soft inner tissue called dental pulp. Researchers have discovered that this pulp can contain stem cells. Stem cells are unique because they may develop into different types of cells and are being studied for their possible role in healing and regenerative medicine. Okay, so they can regenerate. Nice. Scientists continue exploring whether dental stem cells may one day help with bone repair, nerve regeneration, tissue healing, and other medical advancements. This does not mean wisdom teeth are miracle cures or guaranteed future treatments. It simply means science is still learning and uncovering possibilities that once went unnoticed. Sources that inform today's episode include educational materials from the American Dental Association, Mayo Clinic, and National Institutes of Health. What fascinates me most is not only the science, but the lesson behind it. How often do we dismiss something because it arrived with discomfort? How often do we reject a season of life because it challenged us? How often do we look at ourselves during difficult times and fail to see our own value? Makes you think, right? Because we do that. We look at ourselves and we don't see any value because we think we failed. A painful chapter can still hold wisdom. A setback can still hold growth. A disappointment can still shape strength within us. Even seasons we wish had never happened may carry lessons that help us later in life. Wisdom teeth, in their own strange way, remind us that inconvenience and value can exist in the same place. Sometimes may cause something may cause discomfort and still hold purpose. That truth reaches far beyond dentistry. That truth reaches into life itself. So now if you know someone who is considering having their wisdom teeth removed, it's always important to tell them to ask if it is medically necessary. If it is not necessary, don't even bother. Just let them grow in the way they should. If they do have to be removed, you have to ask them what's the risk and what's the benefits. I had mine removed because I was in a lot of pain, so the benefit was I needed them to come out because they were all impacted. What was the recovery? What was involved? And this is something new, and it's because of the stem cells. You should ask them, the dentist, or it's usually an oral surgeon, is stem cell banking available where you live? What does it cost? And is it worthwhile for your personal situation? So you might want to save it. I don't know. You might want to bank it. You never know. But you can always ask questions because there's power in questions. There's wisdom in being informed. Your health deserves careful thought and clear guidance from licensed professionals. Friend, today's message is simple. Do not be too quick to dismiss what looks ordinary. Do not assume when inconvenience means something has no value. Sometimes hidden treasures live in unexpected places. Sometimes what gets removed still teaches us something. And sometimes life's detours reveals gifts we never knew were there. Sometimes the strange things we dismiss too quickly may have more value than we know. Thank you for listening to the Unexpected Detour. Until the next time, keep moving. Oh, no, I don't like that one either.